Patient books their initial appointment on the phone. They will receive in the mail our new patient packet. Inside the packet will be very detailed health history forms for the patient and their partner if they have one. We ask that the patient fill them out and return them at least a week in advance. There's an envelope that's already addressed that they can use to mail it back. The physician likes to receive these a week in advance so that they can prepare for the consultation as opposed to spending time during the consult reviewing their history. They may also receive in the packet treatment handbook and consents, and there will also be directions to the practice as well as information about the physician they're going to see as well as the practice in general. On the day of the initial consult, the patient and her partner, if she has one, should plan to be in the practice roughly 2 hours. The reason being they will meet with the physician for approximately 1 hour for their consultation. Then they will have a seat back in the waiting room while the physician brings the nurse up to speed about what they discussed, and then the nurse will come out and meet with the couple to review the logistics of any testing they may need or any treatment they may need. The couple should also bring to the consultation their driver's licenses as well as their insurance cards, as we copy those at the initial consultation, and they should bring with them the new patient packet they received in the mail as well.
At RSC New England, we follow a team approach. You're definitely not alone or reliant on only one person. You'll have a doctor, nurse, embryologist, and other professionals managing your care.
At the first visit, it's really an opportunity for the patient to meet the doctor and for us to get to know the patient better. Usually we start out by reviewing the medical history done.
When the patients come in to see the physicians for their initial visit, as well as for any visit thereafter where a treatment cycle is being put together and assembled for them, the patients will meet with the nurse either to explain further the testing that they will be undergoing and to explain how to access their nurse, how to make them aware of when their menstrual cycle has begun, and kind of to lay out the process for them. When they're undergoing an IVF or insemination cycle, they would meet with the nurse after that visit with the physician in which the treatment plan was explained to kind of get a cycle calendar, something that can be an ongoing guide for them throughout the process, and to know that the nurse will really kind of help them along every step of the way.
After we find out a patient's pregnant, we often follow their pregnancy hormone levels, and depending on how they're rising, we either do it every 48 hours or we can do it weekly, and then between 6 and 7 weeks we'll do an ultrasound to confirm that the pregnancy is both inside the uterus and to confirm a heartbeat. And once we confirm that the pregnancy actually has a heartbeat and it's a viable pregnancy, then we will refer them back to their OBGYNs.
At the start of the patient's journey, we want them to know that we're here to do everything possible to help them have the very best experience in their journey to parenthood.